I'd like to talk about rheumatologic disorders. Primarily, the key diagnosis here is really going to be rheumatoid arthritis. I'd like to talk a little bit about the pathophysiology and how MR has really helped us understand the pathophysiology of these diseases, especially rheumatoid arthritis, by far the most common one. MR is very important, I still think, in making a diagnosis, and we'll go through that, and at the end I'll talk a little bit about how it can be used today. So a little bit of historical perspective, talk a little bit about DMARD therapy. It's important to understand how these things are treated because there's real treatment now that's very effective as opposed to when I was in medical school. So this is what we don't want to see. This is end-stage rheumatoid arthritis. This patient is not very functional and cannot use the hands. There's a lot of destruction here, as you can see, in foreshortening of the digits. So now we want to make the diagnosis early and stop that from occurring. So in the old days, gold was proven probably 50 years ago, but gold is very toxic and has very little efficacy, really. Steroids were used, but steroids has a lot of side effects and were not effective treatment. So basically, there was no real effective treatment for rheumatoid arthritis until the late 1990s. Now, methotrexate in the 1980s was used in high dose for malignant tumors, very toxic, but in low dose it was found out in the early 1990s that it was very effective against rheumatoid arthritis, and it's still the mainstay for treatment, and it's a relatively inexpensive drug, costing about $700 per year. But though a lot of the symptoms will be resolved with methotrexate, methotrexate is not very good at stopping the erosive disease and the destruction of joints. So fortunately, right around 2000, the biologic agents, which are much more expensive agents, were found to be efficacious, and these are much more effective against the destructive disease. So now the mainstay is typically a combination of low-dose methotrexate and the biologic agents, which are antibodies against different molecules involved in the complement cascade, which produces the inflammatory reaction in humans. Non-steroidal anti-inflammatory drugs are really not, and really have very little efficacy as anti-inflammatory drugs, despite their name. It's almost a misnomer, and they've been shown not to be at all useful in any of the rheumatologic diseases. So this is just some of the early data showing that biologic agents could be effective. This would be the normal course of progression of disease, and in someone who started on methotrexate, when you give, in this particular study, the biologic agents, you substantially decrease the rate of progression of erosive changes.